Elfolate, also known as folic acid, is a B vitamin that is important for forming healthy cells, especially red blood cells. It is naturally found in some foods, but supplements may also be taken to treat or prevent low folate levels. Low folate levels can lead to certain types of anemia, and conditions such as poor diet, pregnancy, alcoholism, liver disease, certain stomach/intestinal problems, kidney dialysis, among others, can cause low folate levels. Women of childbearing age should make sure to get enough folic acid to prevent infant spinal cord birth defects. The daily dosage of Elfolate varies depending on individual needs, and it is best to consult with a healthcare professional to determine the optimal timing for taking this medication. When taking Elfolate, it is important to follow the instructions given by your doctor. This may include taking it with or without food, usually once daily. If you are using the over-the-counter product, be sure to follow the directions on the package. If you have any questions, it's best to consult with your doctor or pharmacist. The dosage of Elfolate is based on your medical condition and how you respond to the treatment. It's important not to increase your dose or take it more often than directed. To get the most benefit from Elfolate, it's important to take it regularly at the same time each day. It may also be helpful to follow a diet plan recommended by your doctor or dietitian. If your condition persists or worsens, or if you have any concerns about your health, it's important to seek medical help promptly. If you experience any unusual effects from using Elfolate, be sure to notify your doctor or pharmacist right away. However, most people who use this product do not experience serious side effects. In rare cases, a serious allergic reaction may occur, so seek medical help if you notice symptoms such as rash, swelling, dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so be sure to contact your healthcare provider if you notice any other effects. As for the best time to take Elfolate, it's recommended to follow your doctor's instructions for the daily dosage and timing. Before taking Elfolate, it's important to talk to your doctor or pharmacist if you have any allergies or if you are allergic to any of the ingredients in the product. You should also discuss your medical history, especially if you have a vitamin B12 deficiency. It's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. When used as directed, Elfolate is safe to take during pregnancy and is included in prenatal vitamin products. Taking adequate amounts of folic acid during pregnancy may help prevent certain spinal cord birth defects. It's important to consult your doctor for more details. Folic acid passes into breast milk but is unlikely to harm a nursing infant. Consult your doctor before breastfeeding. As for the daily dosage and optimal timing, it's best to follow your doctor's instructions for the proper use of Elfolate. When taking Elfolate, it's important to be aware of potential drug interactions. Some medications may alter the way Elfolate works or increase the risk of experiencing harmful side effects. It's crucial to keep a record of all the products you use, including prescription and over-the-counter medications, as well as any herbal supplements, and discuss this with your healthcare provider. Never make any changes to your medication regimen without first consulting your doctor. If you or someone you know has taken too much Elfolate and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an Elfolate overdose may include changes in mental or mood. It's important to remember not to share Elfolate with others. While taking Elfolate, it's important to have lab and medical tests done, such as a complete blood count, folate blood level, and vitamin B12 blood level. Make sure to keep all of your medical and lab appointments. If you have any questions, consult your doctor for more details. Folate is naturally found in leafy green vegetables, organ meats like liver and kidney, citrus fruits, and other foods. Folic acid is added to enriched grain products such as bread, pasta, and cereal. If you want a diet plan rich in folate or folic acid, consult your doctor or dietitian for more information. As for the daily dosage, it's important to follow your doctor's instructions. Typically, the recommended dosage is once a day. The best time to take Elfolate is usually in the morning, with or without food. Remember to take it at the same time each day for the best results. If you forget to take a dose of Elfolate, take it as soon as you remember. However, if it is close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing Elfolate, it's important to keep it at room temperature away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to getting rid of Elfolate, it's essential not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you're not sure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.